Let's start with the expose of 15 square for David Smith. Right. David, it's your turn, please.
Hello, Guy. My technology's failed me. My iPad has just frozen where I've got all my notes. So bear with me a second. Oh, that's better. Right. As Guy just said, I'm David, and I'm the Chief Officer of a UK charity, 15 Square. And 15 Square was formed 25 years ago as Norm UK, and it was to help men who had been damaged physically or psychologically through circumcision. It was actually founded by a doctor who realised that he'd been damaged, and he formed the organisation. What are our major challenges and strategy? I'm going to start by telling you what the current situation is in the UK. And I think it's important to say that. In the UK, non-therapeutic male circumcision, it's not provided on our National Health Service. It's not performed routinely, but it's often used as a first course of treatment for any problem affecting the foreskin. And it should only be recommended when other less invasive and less risky treatments have been tried and they haven't worked. However, many doctors are unaware of alternative treatments, and I think we've covered this before, and they often use circumcision as the first course of treatment. So according to the statistics, approximately 7% of boys are circumcised with phimosis by the age of 15. But the rate of true phimosis in this group is 2%. So this indicates there's a large number of circumcisions are being performed where conservative treatments should have been provided. And there's also evidence that non-therapeutic circumcisions have been given a diagnosis of phimosis. So how do we reduce the amount of medical circumcision? And I think there we've got an ally in the advent of the internet, and that's been a great help to us. Many men, they're having issues with phimosis. They're being told by their doctor that circumcision is the only treatment. But when they're told this, they often go home and they research online, and they suddenly find out that there are alternatives, and hopefully they will find their way to our website. So I want to cover the evidence-based research info supplied to parents. To help these men, we have two booklets we supply in PDF format, and the first is entitled Alternatives to Circumcision. And this describes the steps that they can take for the patient to solve the problem himself. And if he needs to consult a doctor, it also details the steps the doctor should offer before resorting to circumcision. And we have another booklet going on from there. So that's entitled Clinical Guidelines for the Treatment of Phimosis. And this booklet's intended for medical professionals. And it tells them the treatment doctors should offer to treat phimosis. So that's also good, because if the patient takes this to the doctor, he knows that the doctor has to follow the proper course of treatment. It's not possible to download these booklets from our website, and we've been asked many times why. And they have to be requested. And that means we have an audit trail, and we can monitor how many times they've been supplied. And it also enables us to generate statistics. And it means that we can have follow-up information to document. So sometimes they will tell us what is wrong with them. They'll tell us the degree of the phimosis. They'll tell us their age. It's all useful to generate statistics. We also have a facility where you can consult a foreskin-friendly doctor online through our website, and this feature is quite well used. And our doctor is also able to give advice on foreskin restoration. And a lot of men prefer this because they don't have to go and have a face-to-face meeting with a doctor. They can have an online meeting, and they can have they can talk through all their problems. We need a full and accurate follow-up. And circumcisions, they're often performed in childhood, as we've been talking about. And from the medical perspective, it's considered a success if there's no immediate complications, such as bleeding or infection. And the NHS states that, and this is a quote, in the UK, complications after circumcisions carried out for medical reasons are rare, and most men don't experience any significant problems. Once the circumcision's healed, there's no further follow-up carried out, and the true incidence of complications after newborn circumcisions is totally unknown. Now, complications may not become apparent until the boy reaches puberty, when they may experience problems with erections if too much skin has been involved, if too much skin has been cut off. I mean, a boy changes a lot at puberty. They might have sensitivity of the glands, or they have a lack of sensation following the loss of the frenulum. And all this can lead to difficulties with masturbation or intercourse. And we think in order to assess the full impact of neonatal circumcision, it would be necessary to monitor the patient until adulthood. But to do this, there would need to be accurate records kept of the procedure. I'm now going to talk about correct record keeping. In 2008, our charity tried to open a dialogue with the General Medical Council to try and discuss the various ethical issues associated with circumcision. It took until October 2012 before we were granted a 1-hour meeting with the Ethics Committee of the General Medical Council. The GMC representative agreed, and she said that she thought there was an educational need that she could investigate, and there was also a need to look at the urology curriculum. And also there was a need to explore non-surgical alternatives and a training need. But finally, we suggested that there was a need for formal registration of the procedure to record who was circumcised, when, where, how, and by whom, and that adequate records needed to be kept and audits carried out. And everybody in that room agreed that this was essential. So we went away from the meeting and I did all the follow-up notes for them, but they refused to enter into any further dialogue. So much so that there was a stunning silence, and a few months later we submitted a Freedom of Information Act, which you can do in the UK, to asking them what action they'd taken following our meeting. And it turns out they'd taken no action, they just totally ignored all the evidence. And 8 years later, the situation's still the same. But this is an area we're going to be coming back to. I talked about evidence-based research supplied to parents, and there's a circular logic. The circular logic of circumcision is the main hurdle to further research. And the circle starts when men issue a complaint. And first of all, when they issue a complaint, the doctor denies the complaint's legitimacy. Nobody's ever complained about this before. It's not an issue, go away. So they disregard the opportunities to record the complaint. And as a consequence, they dismiss the opportunities for research. Because they haven't recorded the complaint, there's no research material, there's no log. So therefore, they continue the poor practice that they've done for years. And it's a systemic issue, and it's endorsed by poor policy. And we think that to combat this, we need to square the circle. And first of all, we need to make sure that all complaints are recorded. Then we need to follow the complaints up rather than just record them. Then that will give the research information. And finally, this may improve policy and information. We also think that there's a need for professional emotional support. And the harm of damage of male circumcision, it's for generations been ignored, and it's only now being openly discussed. And evidence exists to provide conclusive proof that the practice can have a lifelong negative impact. But because of the lack of empathy, people have been reluctant to seek professional help and support. And we have quite a bit of research on our database. And it also shows, this is some of the things that our research shows, that the loss of a body part has an impact in the way that mastectomy or hysterectomy has on females. The impact on sexual confidence and sexual functioning. There's a sense of grieving and loss and of a feeling of very stuck throughout life. And religious circumcision creates its own set of issues because people feel as though they're attacking their own religion. And it's always a solution looking for a problem, cervical cancer and now HIV/AIDS. And as we said earlier, the decisions taken by others. So it's a passive sense of being a victim. But there's a rationale attached to it. You've been made clean, you've been improved by this mutilation. But the decision is rarely ever based on fully informed consent. Over the years, we've held a series of group support meetings where men can talk through their trauma with each other. And interestingly, over the time that we've been developing this, it started to include partners. And the partners very often realize that their loved one has an issue that they won't face. And in fact, some partners contact us because their loved one won't talk about the subject, so they get the information from us to be able to help the partner. And this current pandemic's caused many problems, but we can't hold meetings, but it's given us many opportunities, and this meeting today is an example of that. And last month we had an online support meeting using Zoom, and it proved to be really successful. And we had about 12 or 14 people on it, and it was absolutely fantastic. So we've got another one for the coming month. And we're also investigating day workshops for affected men and partners and small conferences. So we might have a workshop on the treatment of phimosis with our doctors. We might have a workshop on restoration. But that's really as far as we can go to help them. But many men, they find the meetings of value, but some men need more help. One man said to us, I have a quote here, "How many of us have the skills of a counsellor? Males can feel isolated, ashamed, enraged, and have no allies in his family or immediate circle of friends. We're not yet getting the help we need to manage this life-changing news, maybe the worst of our lives. And I want men supported and not by the average mental health practitioners that are ill-equipped to help us. In fact, they tend to exacerbate our distress. And this is truly specialised work, MGM trauma, due to the overwhelming denial of the levels of harm. Who in the mental health fields can we trust to collaborate or support, and a place to refer men who clearly are in turmoil on this issue?" We've had two. There's an American specialist, Ron Goldman. He's done some work on trauma, which is very good. And we also had a specialist on treating trauma in the UK, and she did a survey on 19 men. She was used to doing surveys of women who'd had trauma following gynecological problems. And on the 19 men, she said they all had stress levels equivalent to Vietnam War victims. But many counsellors and psychotherapists, they don't fully understand the psychological damage, and often they make the matters worse. And there again, another man said this to us. After visiting a psychotherapist, he refused to believe that anyone could have negative feelings about circumcision, and that I was using this as a cover for some other problem. The interview was a total disaster, and I left feeling as though I have been sexually abused by a dirty old man. But this is fairly typical of a lot of the psychological professions. So we have over the years held some training events to try and train psychotherapists and counsellors in the specific damage caused by male circumcision. Unfortunately, our workload is so great that we haven't had a lot of time to continue with this, but we have one or two people who are beginning to come round, and we hope we will be able to have a network that we can actually refer men to. But I'm going to finish by saying what we really need to do is, as an organisation, we need to listen carefully to what circumcised men are saying, and we need to respond with empathy and professional help. That's sadly lacking in some of the professions, and I hope that we're going some way to curing that. Thank you.
Thank you, David.
Any questions?
David?
Yes, Michael.
Yeah, I have a question. I know in Britain there seems to be some progress with the courts, a little bit of progress, and I was wondering if there's any sort of update to that or your sense on where things might go there. And then also in terms of your progress with the BBC and the recent documentary success you've had, if there's any new emergences there. And if you could share a bit about your relationship with the BBC.
We have a very, very good relationship with the BBC. Last year, they did a story about a mother whose son took his own life at 23 following a circumcision at 21. When that story hit the BBC news site, web stats went up, they mentioned us. Our web stats went up from an average of 100 visits per day to, on one day, 2,692, and we were just swamped. They've done several more stories. I think they've done about another 2. I'm working with the BBC on quite an interesting story at the moment. Unfortunately, I can't give any details, but I think it's going to be a very difficult one to research. But I think if this one works, it will be an eye-opener, and I think it will hit the press worldwide. It's been a very, very good relationship with the BBC. Sorry, what was your other question, Michael?
And I was wondering if you could give us a little bit of a sense, your sense of the British courts, because there has been a linear improvement, a linear progression, and I was wondering where that may unfold, how that may unfold in the next 5 years.
Yeah, I was involved in all the cases that have been through so far. Well, all but one, sorry. I was involved with one in the 1990s. It was very little record of it now, but that was a success. But the success, when 2 parents agree to a circumcision, it's normally not controversial. It doesn't go to the courts. Where it goes to the court is when one parent says, I do not want this child circumcised, and the other parent is insisting it is. And in all the cases, it's where one of the parents had a religious belief that demanded it, and they were saying that you know, it had got to happen, and the other parent was saying no. In the cases that have been into the British court, they protected the children because they said in all the cases, the children didn't follow the belief, in all cases it was the father. So therefore it wasn't in their cultural interest, and they were protected until they could make up their own mind. So it is growing, and there are, I think, as I say, there have been 3 or 4 now, and they've all had the same outcome. So I think it's making the courts aware, really. So I'm hoping for some more successes. It's gone very quiet.
Thank you, David.
Sorry, yeah.
David?
Oh, sorry.
Sorry, Jason. Jason's involved in this as well. He works with me, so he's on the screen at the moment.
Well, I was just going to say a very brief comment, just that tomorrow I'm going to present some of the statistics, because obviously everyone who contacts us for our information Often they tell us a story as well. We've got 25 years worth of data, and tomorrow I'm doing a presentation that just talks about some of the stories that men are sharing. We're hoping this will give us a bit of leverage to start improving medical policy as the problems become more and more evident, but also grounds to do more and more research to make absolutely clear to the medical profession that these are considerations that should be taken into account because of the similarities between MGM and FGM. So it's just a side comment on some of the things that, some of the data that we managed to get as well from this. That was all, sorry.
Yeah, it's really interesting. It's really interesting. I mean, since the BBC have worked with us, it's really increased our profile. The other interesting thing this year, a well-known television personality has done a comedy routine based on his own circumcision. His name is Tom Rosenthal, and he was devastated. He was circumcised not for religious or any other reason, 6 days old, and he has done a really good show that he's put on. He did it at the Edinburgh Fringe, and it's eye-opening really, because I didn't think that comedy and this subject went together, but there's a real message at the same time as making you have a laugh, and I think that's another way of getting the message over. And I think that Tom says that you will never get anywhere in this with anger. You need reason, and I think he's very right on that. 15 Square refer men to doctors. David, did you read DAC dossier on the, I'm sorry, who, I just missed that. Who was that?
It's me, David.
Oh, sorry.
I was wondering, you said your organization is referring men to doctors?
Well, we have one doctor, actually.
Oh, one, okay,
Yeah.
okay.
Yeah.
Okay, because I was wondering how the knowledge of doctors about the penis health, how it was in relation with the dossier that the WWDOGA did on the health of the penis. I would ask you also if you read that dossier.
Yes, I have, and we need to be getting more doctors on board. We have some supportive doctors, but a lot of them won't go public, and what we really need is more doctors that we can refer people to, and that seems to be the problem. I think one of the main issues now is because of litigation, and a lot of doctors are frightened of giving information in case they get taken to court. So yes. So another one, so that's another interesting one. Could 15 Square highlight to the BBC the recent Irish court case of the Nigerian man in prison for a botched circumcision? I think that's another interesting one, because there's very little guidelines on this. It's technically he's done nothing wrong. It's only when it's according to the law. I mean, he has, because if you use the Offences Against the Person Act, he's committed a crime. But it's a case where the law turns a blind eye to it, and this has only happened in this past week, and I haven't really had time to check that. But it's a very interesting case, and I saw only this morning, apparently he's done 12 other operations, but I've got to follow that up. When will the current BBC cooperation go public? Certainly not within this next 3 or 4 months. This is a major story, but in order to get the major story, we've got to build up quite an evidence to bring that story.
Dear David, I posted the link to this dossier of WWDOGA, and you are all invited to make, you know, there's some tool existing like DeepL.com to make a translation in English and other languages, because it's very complete.
Yes. Thank you, Guy. That might be good to put on our website, actually. Yeah. Yeah.
That's a little bit the purpose of our group.
Yeah. Any more questions?
Thomas posted the link.
I used to complain to my own doctor who grew up in Egypt. That was amazing, because when I was in my 20s, I went and complained to my doctor, and he said, nobody's ever complained about this before, trying to throw me the door. And I said, well, you won't be able to say that to the next person who comes in and complains, but I bet you will.
No, the link posted is very interesting. It's an article of the Irish Times.
Yes.
About some guidelines.
This is fairly new. Yeah.
From today.
Yes, it is. I only saw it this morning, so I haven't really had time to look at it.
Okay.
I think Victor said something interesting, that it's true about the lack of interest in long life complications. Even constructive surgeries are only a public issue if the affected are women. And I think that's true. And that's, as I said, I think that's one of the areas we need to press for. We need a follow-up.
Yeah. I was really shocked 2 years ago when a young refugee called me and sent me his urologic testimonials about the surgeries he got in Germany finally. After 4 times the public payment for this had been avoided, the doctor helped him to get this financed. And he told me that the doctor who did the surgery told him that this happens regularly. But of course, nobody ever, especially from Muslim refugee communities, ever talks about this. The shame is so enormous. And I was so shocked because, well, as I said, the male suffering is absolutely invisible.
Yes,
absolutely
very
invisible.
true. Yeah.